Okay, we're doing part 23 of Prevent and Reverse Kidney Disease by me, Pete Rogers. We're on page 140 if you're following along in the book. We're going to mostly be talking about autoimmune disease and leaky gut, increased intestinal permeability in this lecture. So this is figure 6-7. Basically, modern textbooks still say that brain cells and neurons are not affected by insulin resistance, but that's incorrect because brain cells, neurons, have glucose type 4 transporters for getting glucose into the cell. Now, what you will see in the books is that there's glucose type 1 transporters across the blood-brain barrier, and glucose type 3 transporters in neurons that do not require insulin. So yes, that is true. There's a baseline amount of glucose uptake into the brain and into the neurons that doesn't require insulin. But you also have glucose type 4 transporters that enable the cell to take up more glucose when it needs to, which are insulin dependent. So these insulin resistance problems can affect those cells. And it's also coupled to mitochondrial function. So you can get a series of progressive problems. And a neuron needs the ability to not just function at a baseline, but to ramp up its activity when that part of the brain's in use. So this is part of the reason why a cell with insulin resistance isn't going to adequately ramp up its glucose utilization in the setting of increased need because of those glucose type transporters. What I'm basically saying is this is why diabetes makes people stupid, because they can't raise the function energy level of a neuron because of insulin resistance. This is one of the many things that makes them stupid. And they also have a lot of atherosclerotic disease in their brain arteries. Okay, now the main topic of this talk is going to be talking about leaky gut. So a normal gut, also called the enteric tract, so the lining cells are called the enterocytes. And the way it works properly is you have good gut bacteria. They eat dietary fiber. The good bacteria have a smiley face. They convert the dietary fiber into short-chain fatty acids, SCFA, in particular butyrate, 4-carbon butyrate. Same thing also as like butanoic acid, 4-carbon carboxylic acid. The enterocytes use that to make TJs, tight junctions. These tight junctions prevent abnormal bad things from getting across the gut lining. And under normal conditions, that's great. Okay, as Jeff Nelson has said, fiber is your friend. You know, fiber means life, pharma means death. And basically, if you have leaky gut, you got problems. Most common reason for leaky gut is a lack of dietary fiber, but there's other things that'll do it. Antibiotics, omega-6 oils, excess saturated fat, meat, dairy, glyphosate on non-organic food, herbicides, caffeine, psychological stress, sleep deprivation, alcohol, fluoride in your drinking water, excess chlorine in your drinking water, aluminum in your drinking water. So there's a whole bunch more. Anyways, things that will cause leaky gut are bad. Bacterial toxins like LPS from gram-negative bacteria, lipopolysaccharide, get across the gut lining. LTA from gram-positive bacteria is the gram-positive bacterial endotoxin. They get across your blood. They get into your blood. They can be prothrombotic, and that can plug up small arteries in your kidney and elsewhere. In addition, big chunks of protein can get across the gut lining. And because they're from an animal, this is with animal foods, the protein can be similar enough in its structure to the own proteins in one's body that the antibodies that form to it can cross-react with your own body. Because the protein structures are similar, that's called molecular mimicry. Auto means to attack oneself, autoantibody. So molecular mimicry leading to an immune response, leading to autoantibody cross-reactivity with one's own body. That's the main mechanism of autoimmune disease right there. There's other ones, but that's the main one. And that's also why if you fix leaky gut, you can often cure the patient of autoimmune disease. You're not going to reverse the tissue damage that's already occurred, but you can prevent ongoing tissue damage in a lot of patients. Okay, this is just a text pretty much going into more detail over what I said. And that's another reason to be 100% vegan, to avoid molecular mimicry issues. Okay, now here's showing what happens with clotting. When you've got leaky gut, you get these bacterial endotoxins across the gut wall. They get into the blood. In the blood, they catalyze a change in the shape of the clotting protein fibrinogen. It goes from being alpha helix, like a cylinder, to becoming flat, like a deck of playing cards, beta-pleated sheet. And these hydrogen bonds, instead of being within the same molecule to hold it into position like a slinky cylinder, they form in between the separate molecules and they stick them together. So the molecular weight keeps getting bigger and bigger, like piling up a higher and higher deck of cards. The larger the molecular weight of a substance in aqueous solution, the more likely it is to precipitate, which means to clot in the blood. So this forms clot. These are called amyloid clots. The change in secondary protein structure from alpha helix to beta pleated sheet is called an amyloid transformation. So these forms amyloid clots. Amyloid clots are also called fibrinolytic clots. Douglas Kell from England, PhD, and Etheresia Praetoris from South Africa, PhD, are the main ones who've done work on this. They deserve a Nobel Prize. But no one knows about it, and probably no one will ever know about it on a wide scale because they don't want people to know about it. But it makes the point. You don't want leaky gut. Okay? Excessive free iron can do about the same thing. It'll basically catalyze fibrinogen going from alpha helix to beta pleated sheet, and then these subsequent events will follow. These microclots. They're typically about 200 microns in diameter, big enough to plug up some of the small arterial vessels in your heart, your brain, and elsewhere in your kidney. Okay, other bad things that happen when you've got leaky gut. Bacterial endotoxins go up to the brain, to the blood-brain barrier. Because you have gut barrier leakage, you'll often have blood-brain barrier leakage because they're both dependent on butyrate, the protein coming from the dietary fiber. And now these bacterial endotoxins can get some access to the periphery of the brain. And when the brain cells bind to it, the brain guard cells, macrophages, they feel everything like Braille. And once they feel something that doesn't belong there to them, they know this indicates bacterial invasion. So they sense that there's incoming bacteria. So they release a bunch of toxic chemicals to sterilize the area. Excuse me. And the relevance being, this could cause a little bit of inflammation of the outer surface of the brain, and that can cause some brain fog. You don't want that. Make you stupider. Okay, I think we'll leave it at that for now. I hope you found that helpful.